My name is Dr. Kent Hoffman. I'm an osteopathic physician. I'm board certified both in addiction medicine and family practice. I've been board certified in family practice for about 30 years, and I've been board certified in addiction medicine for about 13 or 14 years now. And I've been practicing addiction medicine for approximately 20 years. What Xanax is typically prescribed for would be anxiety, panic disorders, and technically it's a benzodiazepine. So it falls within the sedative hypnotic class of drugs. Way back in the day, the benzodiazepines were actually what they thought to be a very much safer alternative to the barbiturates, which were their precursors in the sedative hypnotic class. And I think the first one was Librium, which is chlordazine epoxide, and that was initially brought to market in about 1960. Now we predominantly use it for alcohol detox and things like that. It's not used so much because it has such a long half-life. It's a period of time that the medication, there's half of it left in your system. So they're much shorter, cleaner drugs, if you want to look at it that way. There's several off-label uses that Xanax is prescribed for, and those would be things like seizure disorder, perhaps. They use it sometimes as a preoperative medicine, although typically Valium or Versed would be used for those things. Benzodiazepines prior to surgeries or procedures would be helpful in calming people down, but they also act synergistically with some of the narcotic medicines, such as pain medications. For example, with colonoscopies, one of the common cocktails would be Versed, which has kind of an amnesic effect and calms you down. And then either fentanyl or one of the other opioid medications. Xanax actually, within the body, stimulates the GABA receptors. And GABA is like our brain and our body's natural Valium. And so by stimulating these receptors, it gives you, a Valium-like response. That would be, you'd be more chill, more relaxed, less anxious. If you're taking a Xanax consistently and, with prolonged use, you will develop tolerance. And so whereas initially a given dosage might, really chill you out or put you to sleep even, really sedate you, later on, you'll notice, kind of very few effects. Again, it depends on how high the anxiety level is compared to how high the dosage is. And if you meet those two, then you shouldn't get a lot of sedation with the medication. If, however, you have very little anxiety and you're taking a high dose of Xanax, well, then you're going to be very sedated. But if you're wondering what Xanax looks like, with the generic medications in this day and age, it can honestly look in a variety of shapes. And historically, the lower doses were round tablets. The 1 milligram was a football shaped, and so the kids on the street would call them footballs. And then the 2 milligram divvy dose bar is shaped like a bar with 4 demarcations in it. So you can break it to 1 milligram, you could break it to a half milligram or 1.5 milligrams. And on the street, the kids call those ladders, school buses, bars, a variety of things. For a safer alternative, moving out of the benzodiazepine class, which are all potentially addictive, moving to either a longer half-life benzodiazepine, something like a Librium, or some people consider Klonopin to be safer. I'm not sure I believe that so much, but otherwise, there's a variety of other medications, SSRI drugs that can be used for anxiety, which are things like Zoloft and Prozac and Paxil, or medications, such as gabapentin has been used for anxiety. Buspar is a non-narcotic medication, non-addictive solution to anxiety. So there are a lot of different medications that might be safer to use for anxiety. There are some people who take Xanax every day and use it long term. I think probably its greatest benefit would be as a short-term medicine for acute situations, a death in the family, or seeing something extremely traumatic, maybe a car accident, things such as that, because it has a pretty much immediate onset and about a 6-hour half-life. So it's potentially, our brain likes anything that takes off very quickly, kind of like Learjet, much more than something that takes off slowly like a 747. Xanax starts out at dosages as low as 0.25 milligrams. Then there's 0.5 milligrams, then there's 1 milligram, and then finally 2 milligram, the bars or the school buses, as we mentioned. So 1 milligram is a relatively high dose, and of course it depends on how many times a day you take it. So as far as overdose is concerned, Xanax, certainly, depending on what your tolerance is, doses as low as 4 or 6 milligrams would perhaps cause an overdose. In general, the benzodiazepines, in and of themselves, when only taken by themselves, cause rare, infrequent overdoses. It's more common that they're a part of a cocktail of drugs that will cause an overdose. Trying to take the edge off of cocaine, the cocaine high, or adding it to either alcohol, which is basically liquid benzodiazepine as far as our brain's concerned, or otherwise opiates, which will increase the opioid levels. When I talk about alcohol being a liquid benzodiazepine or the benzodiazepine being alcohol in a pill, they affect the exact same GABA receptor in the brain. So really your brain can't tell whether you just took a Xanax or an Ativan, or whether you just did 2 shots of tequila. And the withdrawal is very much similar in both drugs, alcohol and benzos. So the benzodiazepine and alcohol withdrawal are considered, in general, some of the most potentially life-threatening withdrawal processes, because you can have things like seizures, hallucinations, and then ultimately the DTs, which is the delirium tremens, and that's really an ICU-like condition. So with any of the benzodiazepines, you definitely want to figure out what your tolerance was if you were started on one of these medicines. I wouldn't recommend driving or taking other medications, and certainly not drinking alcohol with it, because it's just going to be amplified in its effect. So you definitely would want to figure out, what it does to you and how much it impacts you before you'd want to do any of the kind of normal lifetime activities, like take care of your kids, or, drive to work or drive them to school. Some of the side effects that are common to Xanax would be, first of all, sedation. If you take a higher dose than you need for, say, anxiety, or if you're taking it recreationally, certainly sedation is going to be a major side effect. It's not going to help sexual performance, certainly. Otherwise, really, it's mostly sedation and, those types of side effects. It's discouraged to take it while pregnant or breastfeeding because it's actually can potentially have adverse effects on the baby. And of course, you wouldn't want to breastfeed while you're on it, because your baby could get some of the medication. It can certainly lower blood pressure. The benzodiazepines in general, one of the potential side effects or adverse effects is hypotension, which is lowering of the blood pressure. In general, there are actually multiple studies that have looked at people who've been on long-term benzodiazepines. I think the average was about 10 years, and they showed that the cognitive abilities, speech, recall, a variety of the, what we call the executive function centers of the brain perform much more poorly. So it makes you kind of stupid. The whole family of benzodiazepines, as you can imagine, it is a family, but just like family members, each one is a little bit different. They're a little bit different with respect to how fast they take action, their onset. they're also different as far as how long they last, their half-lives. So you can imagine that with a benzodiazepine that's made for a sleeping pill to put people to sleep, it's going to have very fast action and a relatively short half-life. With Xanax or other benzodiazepines, especially the short-acting ones, people can have withdrawal symptoms after being on it for just a couple of months. Most people will have withdrawal symptoms if stopping it abruptly if they've been on it for a year or longer. And again, getting back to the fact that benzodiazepine withdrawal and alcohol withdrawal are two of the most dangerous withdrawals to go through. You don't want to stop these things cold turkey if you've been on them for any length of time, meaning months to years. So Xanax is a drug of abuse because of its rapid onset and relatively short half-life. That's what our brain likes. Anything that takes off quickly and impacts us quickly, especially when it's combined with other drugs or alcohol. So people like the feeling of being sedated, being down. Sometimes they like the fact that it takes the edge off of cocaine or meth or other stimulants, Adderall. When combined with alcohol, you don't have to be on much Xanax or drink much alcohol in order to be in blackouts. It's almost a guaranteed blackout where you'll be functioning. It'll look like you're just fine, where the light's on and there's nobody home. You don't remember it the next day. Typically, they would abuse Xanax by taking it orally, snorting it. Rarely is it used IV. I just haven't seen that a lot. Mostly it's oral or nasal insufflation, i.e. snorting it. One of the sure signs that you're dependent or addicted to Xanax is going to be that if you miss a day, or if you can't get it off the street, or if your prescription runs out and you start to feel shaky and clammy and antsy. Those are all signs of early withdrawal for the benzodiazepines. And then it goes on to seizures, hallucinations, or at least potentially to seizures, hallucinations, and the DTs. Traditionally, when we do medication-assisted withdrawal, aka detox, we use longer-acting benzodiazepines and try to bring them down slowly. Because again, our brain likes anything that takes off quickly and is short-acting. So when we use longer-acting benzodiazepines, things like Librium, it helps to bring the brain in for a smooth landing. Essentially, we use the same medications to do detox from benzodiazepines as we do from alcohol use. The thing that makes any treatment, that just brings the brain in for a smooth landing so people don't have seizures, hallucinations, and other symptoms of withdrawal. So we try to get them to survive the early detox, but then really the heavy lifting is done in counseling, group meetings, AA, NA, things like that. A lot of people ask, how long does it take to detox from things like Xanax or other benzodiazepines? And it really depends on how short-acting it is and the amount that people are taking. Again, if you're on very low dose, it doesn't take nearly as long. Or if it has a longer half-life, it doesn't take as long to detox somebody. So the higher the dose, the shorter the acting, the longer it's going to take to do detox, especially if you do that as an outpatient. Well, the most successful, programs for people who are addicted to Xanax would be to do an inpatient detox or an outpatient detox if they were an applicable candidate, and then go on from there and be able to do counseling, potentially, inpatient treatment, especially if they were on very high dose, where it would be dangerous, or if they had ever had, previous benzo withdrawal seizures, then it would be very dangerous to try to detox them as an outpatient. So you'd want to detox them as an inpatient, and then frequently they would go on to either a residential program or say an IOP program.